Good afternoon, Mr. Vadodaria. My name is Adi, and I'm here just to ask a couple of questions in regards to the upper blepharoplasty procedure here at MACS Clinic. So, first question, what is an upper blepharoplasty?
Yeah, good afternoon, Adi. Upper blepharoplasty simply is a removal of excess skin from the upper eyelid. Sometimes the surgeon may decide to take a very small sleeve of the underlying muscle, which we call orbicularis oculi, and maybe particularly on the inner aspect, surgeon may decide to trim the fat which is behind the muscle.
Okay, thank you very much. So, if a patient were interested in an upper blepharoplasty here at this clinic, what kind of things would you require from them as the surgeon before they were to come and get that procedure done here?
Yeah. The first thing whenever they inquire about any procedure including upper eyelid reduction, it is our customary practice that our team will send a comprehensive information pack, send the link to our website and YouTube channel so that they can educate themselves regarding the procedure. It becomes very simpler nowadays to do the first consultation on a video so that the patient will have a feel about the surgeon. I like to do a thorough medical screening by asking relevant health-related questions, and then we invite the patient for a second face-to-face consultation and physical examination. At that time, our team will do the health questionnaire, the vital data, the body mass index. I will do my physical examination, some measurements, and then our office will send the procedure fee estimate so that the patient can make an informed choice.
Okay, that's good, thank you. When it comes to the procedure itself, on procedure day, what can I expect if I were to be a patient for an upper blepharoplasty procedure?
Yeah, I mean, a female patient would require a pregnancy test. It's a national law for every female patient undergoing any procedure. The pregnancy test is a must. There will be a consent process between myself and the patient. There will be standard medical photography. The patient will be introduced to our theatre team, the anesthetists, the nursing staff. Normally we have a plastic surgery fellow who assists me. And then patient will be taken into the operation theatre. I would put local anesthetics. Most of my patients, they prefer to get it done under local anesthetics. I like upper eyelid reduction to be done under local anesthetics. A, it is safe, and B, it is cost effective.
Yes.
Operation takes approximately 40 minutes to an hour. I like to use dissolving sutures so that it doesn't require any removal of fine suture manually. And post-operatively, patients will be having an ice pack, and the nursing staff will position them in a semi-sit-up position so that the gravity helps for the reduction of the swelling, bruising, and discoloration.
I was actually going to ask about that, so thank you for bringing that up. Post-surgery, a lot of patients would want to go out, maybe show off their new cosmetic procedure, feel more confident in themselves. But naturally, with it being a procedure with your upper eyelids, that's quite a noticeable part of your face. So in terms of recovery and aftercare, would I see a lot of swelling? What kind of things would be provided by the clinic to a patient for their aftercare from an upper blepharoplasty procedure?
Normally, we give a prescription of antibiotics and analgesics and some eye antibiotic ointment. There will be a post-operative instruction which will be sent across to the patient. I would verbally explain what to do and what not to do. They are expected to put on ice pack for a period of 48 to 72 hours. Nowadays the ice pack are pretty creative and designed in a manner so that people who would like to use their glasses, like myself, then they can wear the glasses over the ice pack, and the ice pack will have a small little hole. So through that they can check their mobile, they can use their laptop or a computer, or even read a newspaper.
It's really interesting, very convenient actually,
Yeah.
to be honest.
Yeah.
That's
Yeah.
good news for most patients
Yeah.
then. Well, I would just like to ask as the final question, obviously we've been talking about how the procedure would be undertaken here at this clinic from start to finish really, but there's many a place that I could get this upper blepharoplasty procedure at in the entirety of the UK, let alone London. So my question is, with regards to here at MACS Clinic, what makes the procedure here different in that way? What kind of things do we provide at this clinic here that would be different for a patient?
It's a very good question. I think I can only give a general guideline
Of course.
about how you should choose a clinic and how you should choose a surgeon. When it comes to clinic, it should be registered with Care Quality Commission, the way MACS Clinic is registered with CQC. It would be a good idea for you to see the ranking of CQC while they came for the inspection. We are very fortunate that we have an outstanding ranking in terms of patient's care at MACS Clinic. In terms of the surgeon, you need to check surgeon's qualification, and generally it would be good for you to ensure that the surgeon is a specialized plastic surgeon on a specialist register. You should also check on surgeon's years of experience. I'm doing plastic surgery for the last more than 30 years, and I think it helps. My gut feeling is that the senior surgeons would be making wise decisions for their patients, and it would be a good practice for every patient to have a feel of more than 2 or 3 clinics and 2 or 3 surgeons. And nowadays everything is transparent because of the internet, so it would be a good idea for you to check the reviews of an individual surgeon and clinic. So that will give you a kind of a gut feeling who is your surgeon and where you would like your operation to be done in a clinic. Now, I have worked in NHS, in private corporate hospitals, as well as in a day case clinic like here. And what I have found that a procedure like upper eyelid reduction, upper blepharoplasty, it's very important that you have a continuity of care with the same place, same administrative staff, same surgeon during your whole journey as a patient. And what I have observed that procedures like upper blepharoplasty, which is done as a day case, the patient find themselves far more comfortable seeing the same people in the same clinic rather than in a corporate hospital where there are hundreds of consultants and more than hundreds of clinical and administrative staff, and they may sometimes find lost coming for such a procedure into such a big a corporate hospital environment.
I would definitely agree. I think it can be overwhelming having a lot of people looking after you, especially a lot of new faces. So it's nice when you get to see the same faces throughout your procedure from start to finish.
Yeah.
It's sort of a warm feeling,
Yeah,
a sort of safer
absolutely.
feeling in a sense. So I get that. I think that concludes the questions for me. Thank you very much for taking the time to sit down with me and talk me through the procedure here. You've been very informative and I very much appreciate it.
Thank you.
Mr. Vadodaria.
I hope it was helpful to clarify your doubts about this procedure.
Thank you very much.
Yeah, it is quite a most of my female patient, they ask for this procedure because they can't apply makeup above the level of their eyelashes.
Mm-hmm.
They complain that it gets smudged.
Interesting.
Second thing is they feel very tired in spite of the fact that they are not tired within.
I see.
It is
Do you
because
mean
of
that
the
more in the visual sense, like they look more tired,
Yeah.
and they can see that they look more tired, even if they're okay.
Yeah, so
Sure.
in the days of so many photographs on social media,
Mm-hmm.
and nowadays even the telephone can take wonderful photographs.
Mhm.
So while they look at their photographs, they feel very tired. While they look at their photograph, they feel that they are far more older looking because of the hooded upper eyelids than what is their age is. And they also get recurrent comments from their family members and the associates with whom they work and friends, that they look very tired and they look more aged than their real age. So very rarely the hooded upper eyelid can compromise their vision.
Okay.
And so these are the reasons.
This is a follow-up question out of interest to that. So we're talking about people feeling that they look a little bit more aged than they are, and that sort of maybe that fear, maybe that insecurity, whatever the reasoning might be, leading them to look and be interested in this procedure for an upper blepharoplasty. Is there a sort of specific age that you would operate on in terms of that procedure? Is there is it only at a certain age range where you would do that, or is it something that anyone can technically get?
In the United Kingdom, you are not allowed to do any cosmetic surgery unless you have completed 18 years of age.
Okay.
Normally, in my practice, people will ask for such procedure after 40 years of their age.
Okay.
Having said that, there is a genetic condition where the upper eyelid could be having far more excess skin at a relatively younger age. Then we need to use our discretion whether to give such a operation at a slightly younger age. Normally, I would ask GP. I would also get a clinical psychologist clearance, and then I would use my discretion. But generally, it is 40 plus. I like my patient to get their eyes checked, mainly to get their document of visual acuity, as well as to check their intraocular pressure, which is the condition which is associated with glaucoma.
Okay.
Yeah. So I would like those things to be assessed before, generally it's a local anesthetic day case procedure, and the patients are generally pretty happy with having this procedure done.
Okay. Thank you very much. I think that's enough for me for today in terms of questioning. So thank you again, Mr. Vadodaria. Thank you for being so informative. Thank you for your time.